Welcome back. It's officially National Ovarian Cancer Awareness Month, which means it's time to help us break the silence. Joining us to tell us what to be aware of is Dr. Edward Kost with UT Health San Antonio. Thank you for being here with us and talking about this very important issue.
Well, thank you for having me. I really appreciate it. It is a very important topic, and certainly ovarian cancer affects many women.
That's right. Now, so talk to me about that. Who does it affect? Who should be looking out for it?
Sure. So age is one of the most important prognostic factors for ovarian cancer. So as a woman ages, really starting at about age 50, as she gets older, her risk of ovarian cancer goes up. The average age is about 63 years old, so it's certainly a disease of postmenopausal women. As far as what kind of symptoms patients have, ovarian cancer was classically described as the silent disease or the silent killer, so to speak, but that's really not true. It's an urban myth that there's no early warning signs for ovarian cancer.
So what are the symptoms? What are the signs? What should we be looking out for?
Andrea, that's a very important question. So multiple studies have shown that women actually have there's really four significant signs or symptoms of early ovarian cancer. And these symptoms, they include abdominal bloating, pelvic or abdominal pain, feeling full early after eating, or bladder pressure. And really these symptoms are related to a mass that's growing on the ovary, pushing on those organs.
Wow.
And the symptoms tend to be severe, frequent, and in short duration. And that's really compared to other diseases like irritable bowel syndrome, where the symptoms really wax and wane over time.
Wow. And I'm sure some of these ladies maybe confuse those symptoms with something else?
Oh, exactly, very true. A lot of the symptoms are fairly vague, so it's important that a woman really be her own best advocate.
Right.
So if she is having any of those four symptoms, she needs to talk to her doctor, be persistent, and really let that doctor know that she's concerned about those symptoms.
Okay, what about detection? Can I get it through a pap smear? How does it work?
I get asked that question all the time. So a pap smear is a very good screening test for cervical cancer.
Okay.
It can detect some ovarian cancers, but it's really designed to detect cervical cancer. And since the advent of the pap smear, we've seen the incidence and the death rate from cervical cancer, decrease by 90%. So we certainly recommend that all women get their pap smears.
Okay, excellent. Some good information there. Thank you so much for joining us and for being here. We really appreciate it. And our very own Roma Villavicencio of Great Day SA, she's an ovarian cancer survivor, and she's serving as an MC at this year's 10th annual 5K run to break the silence on ovarian cancer. We're very proud of her here. The event kicked off at 8 this morning and will run through 11 a.m. inside Mission County Park, and you're invited to show up and show support, or you can donate by going online to runwalk.ovarian.org/San Antonio. We will be right back.